Go ahead.
This is our IABDM Zoom meeting, and tonight we have a special speaker, Dr. Liao, who's a past president of the IABDM and is one of the leading authorities on airway. And so I'm going to turn it right over to Felix. Felix?
Thank you, Dawn. It's a pleasure to be with you all. Today's topic is how you can diagnose with one look at your airway patient, dental patient, I'm sorry. One look at your dental patient, you can tell they have problems. All right, so fasten your seatbelt, here we go. I want to start with COVID-19. I'm going to insert a few slides as to why this airway is really important foundational work. It could be the difference between recovering from COVID and not. So when I looked at COVID, I know that the mouth matters a great deal. And so I want to create, I created a webinar on empowering your immunity against coronavirus, okay? And we can help in our capacity as airway center mouth doctors. That's what AMD stands for. In our capacity as mouth doctors who's focused on airway, really help reduce susceptibility to COVID and mitigate against the adverse outcome, all right? So the mouth is the gateway into the body. Infections are opportunistic. It's never just the germ, it's also the host, all right? So I have a 3-part series on this. And so, like I said, fasten your seatbelt. We're gonna go and take a quick look at this before we dive into the mouth role in whole body health. So here is the a slide on the leading conditions that kill COVID patients from China. This is from China CDC. So the factors between US and China is very much the same, only China is ahead of us in chronological order, and US has got one other feature which we'll go into shortly. So what kills these COVID patients are pre-existing conditions: heart disease, diabetes, chronic respiratory disease, high blood pressure, cancer, okay? So this is death by cytokine storm. Cytokines are small protein molecules to respond to infections. And they respond to infections by triggering inflammation, okay? So what's the difference between China and US? Here's the reason. We have a lot more obesity, all right? We have a lot more calories, and we have a lot more processed food. China is catching up fast, no question. So here's what you need to know about obesity. Obesity is associated with alterations in immunity, a chronic low-grade inflammation, which are elevated circulating pro-inflammatory cytokines, all right? So fat people, I'm sorry, this is not a judgment. This is a cold analysis of your risk liability, okay? The more fat cells you have, the more likely you're gonna have chronic low-grade inflammation. You'll be standing in water that's up to your neck and your chin. It doesn't take much before you're immersed in your nose, okay? So in the US, we have a lot of fat people. Every state except Colorado and Hawaii, and Washington, DC is in big trouble, okay? Here's another slide that shows basically adipocytes, fat cells, both in hyperplasia and hypertrophy, secretes pro-inflammatory cytokines, all right? So 89.3% of US patients hospitalized in March this is from CDC now, US CDC, have these conditions: hypertension, obesity, chronic lung disease, diabetes, and cardiovascular disease, okay? Not that different from China. And if you were to look at leading causes of death, okay? In US, the latest year available is 2017. You can see that it parallels their existing conditions, that pre-existing condition that killed COVID patients, okay? So now there's a new book out called The Cytokine Storm Syndrome, all right? So the more inflammation you have, the more likely you're gonna die from COVID infections. So how do you get inflammation? Well, this is where we come in as mouth doctors, okay? Either from oral infections, we all know about the periosystemic link, or you get it from eating the wrong stuff, too much of the wrong stuff, like sweet tooth, anybody? Dark chocolates, potato chips, all right? PBJ, peanut butter and jelly sandwich, okay? And let me just show you this whole picture. In my opinion, ventilators is the last line therapy. It's an outcome, okay? Like the end of a domino. What starts this whole domino, okay? In my opinion, it's our piece, the mouth. Oxygen deficiency, aches and pains, poor posture, what I call impaired mouth syndrome, okay? Poor sleep quality, thyroid sugar issues, inactive muscles, stress and worry, frantic lifestyle, typical American diet. All of this together will start a domino process that results in a health catastrophe. So we are in a position to do this, okay? We're in a position to warn people that the cytokine storm is ahead. You get to coach people on how to avoid having this iceberg sink their ship by showing them this. Impaired mouth structure that contribute to snoring, sleep apnea, and teeth grinding. Impaired mouth style that contributes to typical American diet, diabetes, and obesity, and both of which add up to inflammation that comes in with pot bellies and double chin. Okay, look at your dental patients, see how many of them have this. Now, this is where we get to take charge, where everybody is trying to do their own thing, but where it starts, like I said, is right here, okay? Now, let me just downsize this a little bit because this is bothering me. All right, so this is what I learned from Dr. David Singh, one of my mentors, and he said there are spaces in the body has a purpose, okay? Structures have a purpose. So this is called the upper airway. If you see my cursor right at the tip of the nose here, we're gonna follow through the nasal chamber, that's zone 1, past the retropalatal space, which is zone 2, down the retroglossal space, which is zone 3, until it goes in down to the lower airway. And lower airway is not a problem because it's ringed by trachea with cartilage rings, and it doesn't collapse. But the upper airway, you know the nose can get stuffy, and now we now notice that the sleep apnea, this muscular tube can collapse because it's too narrow. So an airway center mouth doctor is in charge of all these 4 spaces, okay? We're also the facial architect. So this is the AMD's role. The mouth is the airway, and the mouth is also an infrastructure, all right? How we manage this piece and how we coach the patient on how to use the mouth has everything to do with their whole body health. It's not just amalgams, it's not just perio infections and inflammation. It's also gut inflammation that's a much bigger factor. So here's a patient who is reporting on how this simple upper appliance has helped her. So let me play this for you. And let me warn you ahead of the time that I'll need to stop share and then reshare. Okay, here we go.
All right, so in addition to the neck pain going down from about 8 out of 10 down to 1 out of 10, I got a significant boost in my immune system. I have a 2-year-old and a 7-year-old, so there's always germs and people coming and getting sick. So every time the girls were sick, most definitely I always got it, even if I wash my hands or try to avoid eating after them. And usually I would hang on to a cold for about 2 weeks with significant, intense symptoms. And I most recently got the flu, and it was only 3 days, and it just felt like a cold. I only took like Dayquil, and that was enough for me to continue going back to work and go to bed at 8 o'clock, and I felt fine, which for me, last flu, I was out for a week. I vomited at work and had to leave early.
I remember you told me that.
Yes,
yeah.
it was very bad, and the stiffness, I was in bed all week. So
this time, how many days out of work did you have?
No days out of work.
No days out of work.
No days out of work. Just 3 days of taking cold medicine and going to bed early.
Good for you.
And every month I used to get sick last year, and this time it's just been, once so far. That's good.
As long as your sleep is improving.
That's the secret. Definitely, yes.
So as long as your sleep is improving, your energy should also be improving.
And it definitely has, yes. I'm much able to keep up with my 2-year-old and 7-year-old now. It's not a battle for them to go to sleep now. My life doesn't depend on them going and taking a nap, so it's good.
Great. Thank you for sharing your experience with us again.
No problem. Thank you.
Okay, so that's just a simple testimony on what oral appliance can help with their flu immunity, and it really makes a huge difference. So let me see if I can switch out of this and resume. Yeah. So the bacteria DNA is 16 times higher in a heart attack clot in the coronary vessel than in blood sample. All right. So oral bacteria from perio and from endo could end up in the thrombus in the coronary artery that kills the patient. Right. So the conclusion from this study was that dental infection and oral bacteria, especially the viridin straps, may be associated with development of heart attacks. So this is just a complicated picture of obesity and inflammation. But the conclusion here is very clear, okay? That the more obesity you have, the more inflammation you have. And the more likely you're gonna end up getting intubated but not come out of it, okay? So you as a biological dentist and an airway-centered doctor could help the patient control inflammation, okay? Starting with a healthy mouth structure and healthy mouth use. So let's pull back for a minute and look at this thing called homunculus, which is a body map based on the number of neurons devoted to each part, okay? So you can see that we're wired for hand-to-mouth pattern, all right? This is how we survived in the early days, all right? That's why our hands, our mouth, and our eyes are so well developed, as well as our noses and ears. Everything else is fed by this mechanism, right? Before I leave the subject, I wanted to share with you a 12-step disinfectant procedure for entering home. Home is a sanctuary. Home you should keep safe from infections. And you certainly don't want to bring the germs in from the outside, whether it's COVID virus or not, okay? So this is a cartoon that somehow I got from an online source. It's actually Chinese TV from Canada, okay? So you don't need to be able to read Chinese to be able to tell, but I'll read it for you. So if you're coming from the outside, you leave your shoes outside. You change into your slippers so that you have indoor footwear and you have outdoor footwear, okay? Step 3, take off gloves if you wore any, okay? Wash hands, all right, for the first time. You're gonna wash again later on. Step 5, you take the coat off and leave it outside or leave it in the basement or in the garage. And then you take off your mask without touching the outside of the mask, which means that you only handle the loops, okay? Then you take off your glasses if you wear them and wash your hands for a second time. Now you're free of all the stuff that you brought in from the outside, okay? Then you go inside, you wash your face with your eyes closed, okay? You blow your nose, okay? Or you rinse it with neti pot, okay? You rinse your mouth. Then you wash your hair if you were outside for a long time or if you were in a crowd for a prolonged period of time, and you might want to consider showering as well, okay? So this is a picture of a friend of mine who's got a slipper here on the inside in orange, and this is her porch on the outside where she is putting her blankets out to let UV light disinfect it, okay? So there's a very clear separation between the outside and the inside. And we should do that the same way with our body and with our home. So guess what separates the inside and the outside? The nasal passage and the oral passage, okay? This is what happens when you are a mouth breather from chronic nasal congestion. All right, this young lady's mother brought her in way too late. By the time we see her, why, the damage is done, okay? The mouth and the sinus is really not separate. It's really wrong to have an ENT doctor in charge of the sinus and the dentist take care of the mouth. They're one functional unit because the maxilla, the nose is and the maxilla, basically they're one and the same thing, okay? Let me play you this one.
After my first adjustment, then that's when I didn't have to get up in the middle of the night. After about my 4th adjustment, my nose opened up and I could breathe a lot better. It was like this expansion was just amazing.
We all know what it's like when your cold goes away and your nose becomes unblocked and you can breathe and go, ah. And that's what it feels like. A lot of patients don't know what it's like to breathe through their nose until they start this treatment and change their diet. Okay, so I'm going to show you some pictures and no slides, no pictures, show you some pictures of patients' faces. So what I want to tell you here is that this appliance is on the upper arch, sometimes on the lower arch, but almost always on the upper, because this is not another mandibular advancement approach. Patients, we can do this consistently. When you look at these two, the chin looks very big preoperatively, but the reason is not because she's class 3. The reason is because she is pseudo class 3 because the maxilla is much too underdeveloped. So when you develop the maxilla to match the mandible, hey, she started looking pretty reasonable. Same thing here, okay? Bicuspid extractions. These are twins, same orthodontist. One twin had teeth taken out for braces and the other one did not. Ladies, you decide which one you rather have. Guys, you decide which gal you would rather ask to the dance. Bicuspid extraction cases have a lot more systemic symptoms. This is a bicuspid extraction case. You can tell because these teeth had to be retracted so much to close the space. all right? And as a result of this mandibular entrapment, the patient end up with all this pain. So here's a good illustration of how the nose and the maxilla is really one and the same anatomical organ. My mentor, Dr. Singh, again says, underdeveloped faces may indicate a collapsing or constriction of the upper pharyngeal airway, okay? So the airway is going to be pinched if the maxilla is retruded and the patient has a weak chin, and then they have a, it's called pannus. Pannus is the turkey waddle, the double chin, okay? Because under the mandible, because the tongue has no room to go, and so it bulges out. So Dr. Singh did a study in the University of Malaysia Dental School, and he found out that the maxilla is only 7 to 10% narrower, and the mandible is likely by that same, likewise by that same percentage. So in an arch, it just means that there's one tooth width discrepancy. It's enough to land you in sleep apnea, okay? And so what do? Well, you can use what I call an adult expander for the maxilla. Yes, you can do it on adults now. Yours is no longer flat because there are stem cells in the periodontal ligament that you can signal with this appliance and make them differentiate into osteoblasts. And what do osteoblasts do? They make bone. And as the maxilla grows bigger, as the mandible gets bigger, the airway also gets bigger. It's like when you move the columns of a building, the window gets wider, okay? So this is the first case Dr. Singh published back in 2011. Before treatment, it was 12.9 cc, and after treatment was 22. So when you develop the maxilla and or the mandible, you can this. When I say develop, I mean make it grow in bone volume, not just to move the teeth. Okay, that's what Invisalign does. That's what mandibular advancement device does. Just move the mandible forward and nothing changes in the bone volume. So Dr. Singh is a champion of cranio-facial epigenetics. So epi means in addition to or on top of, like epidermis, okay? Epigenetics are the phenotypic changes without the bodily changes, that is, without changing the patient's own DNA sequence. This is not gene modification. This is not transmutation. This is using patient's own genes to correct and straighten the jaws, teeth, and soft tissues and functional spaces painlessly. So what you do is you put a gear in, put a key in this hole here. You turn the gear, and each turn is 1/4 millimeter. Okay, you do that once a week, and 1 month later you get 1 millimeter. So when you look at this, you know that it's about 4 months into the treatment. So this is my own case. Pre-treatment, I was a weak chin, class 2. And class 2 is always a result of the maxilla being too small. So my airway was pretty much in trouble, okay? How to read this is color scale. It's white is 400 square millimeters in cross section, and red is, and black is 100. So here I have 1/4 of the airway size that I should have. So this is an area that's susceptible to sleep apnea. And sure enough, I did, and I didn't know, okay? This is important. And after treatment with that maxillary epigenetic appliance, guess what? I have everything 400 square millimeters across from the nasal passage all the way down to my lower airway. So I'm safe now. This is your best retirement insurance. It's not that plastic card, it's not what Medicare covers. It's your ability to sleep and renew yourself night after night for the rest of your life, okay? So when the maxilla is underdeveloped, the mandible can't fit in, so the teeth crowd up. So think about how many of your patients come in with crowded lower anterior teeth. It always is a reflection of deficient premaxilla, underdeveloped maxilla in the front end, okay? So with a maxillary appliance, we can make this kind of difference, okay? We not only straighten her posture, but we also help her lose weight because she could sleep better. And we change her airway in the process as an underlying reason. She could sleep better and the body could self-regulate. So her airway went from 11.4 cc to 17.2 for a 51% gain. So I hope I've opened your eyes a little bit as to how to see your place in the care of health by directing your attention not only to teeth and gum, but also to the mouth and the airway, okay? I see a lot of patients. In fact, my practice now exclusively devoted to this problem. So for that, you need to understand this concept that I developed. Holistic mouth is a term that I coined for one that is structurally fit to support whole body health through these functions: alignment, breathing, circulation, digestion, energy, and sleep. Okay, that's what the mouth does. It doesn't just talk, it doesn't just smile, all right? A fully developed holistic mouth looks like this. And you can see that these people never had braces, okay? These kids have radiance, they have wide arches, okay? They have naturally straight teeth. It's not genes, okay? It's the genetic potential. And this is in every one of us. I like to tell my patients that every tooth comes with its own volume of bone. It's a question of development. Whether you ate correctly, whether your mother raised you correctly, and whether you're a stuffy nose growing up, whether you ate allergenic food, okay? And typical American diet is sad, okay? So an impaired mouth structure can eat, but it's defective, okay? And therefore it cannot perform the other functions. And therefore it will contribute to all these problems. Sleep apnea, very common, chronic pain everywhere, adrenal fatigue. If you can't sleep, you're gonna have adrenal fatigue. If you have airway problems, you're gonna grind your teeth, okay? If you have deficient jaws, you're gonna have TMJD. All of that is gonna contribute to leading causes of death. And they're gonna be osteoporotic, they're gonna lose bone, they're going to be hypoxic, they're gonna have pulpohypoxia, which is what a toothache is, okay? And the brain obviously doesn't tolerate low oxygen. So we are in charge of this choke zone right here. So that's why the title of my first book is called 6-Foot Tiger, 3-Foot Cage. So a lot of people are searching for health and wellness, but they have no idea that this 6-foot tiger inside their 3-foot cage, this underdeveloped jaw that forces the tongue into the throat, is hampering their health quest. By the way, all the doctors don't know that either because of this medical dental divide. So here's a case of a patient who's got this Liao sign, which is defined as a upper lip in profile that drops straight down, okay? When it drops straight down, instead of coming out at an angle, it means that the maxilla is underdeveloped. So this patient came in with a sleep test score of 36 and a tongue tie and an oversized tongue. This is a mouth made for trouble. Okay, this is his mouth. When I put in this appliance, you can see that originally the midline was off. Now we lined him up. And you can see that this occlusal intermaxillary discrepancy. No wonder he had chronic low back pain. And what we did was that we expanded his airway volume in 2 months' time. This guy was a data hound. He says, I'm done having kids, just show me how much improved I am because I feel so much better. And sure enough, we gained him 50% of airway in 2 months. All right, so the U-turn back toward thriving health and wellness begins with sleeping well, okay? If you don't sleep well, you're gonna grind your teeth. You're gonna have adrenal fatigue, okay? You need to clean up your infections. You need to clean up your perio, okay? You need to eat healthy. You need to redevelop your jaws so that your tongue doesn't get shoved down your throat. You need to restore nasal breathing, and you need to identify food sensitivities and eat healthier. It's easy to say that, but it's not so easy to do. So that's why we have to serve as a patient's coach, okay? So help them proactively head off this thing called sleep apnea. Because sleep apnea has a whole bunch of complications. And for example, hypertension, okay? 50% of hypertension have sleep apnea, okay? 1/3 are acute heart attacks. 60% of the stroke have sleep apnea as an underlying condition. So if this is an outcome, then what is the start of that downhill slide? The start is in the underdeveloped jaw. 6-foot tiger, 3-foot cage, if you will. So look at this kid. There's no lip seal. There's asymmetries of the nares. The eyes are not level. This is a kid made for trouble. And if you just send this kid to the orthodontist, there's gonna be a lot of unhappiness later on in an adult life, never mind in school performance, academically or athletically. So one thing I learned, another thing I learned from Dr. Singh, I learned a lot of things, is that in adults, it's likely that palatal and mandibular tori manifestations of undiagnosed sleep disorder breathing. So you ever wonder what tori really represent? It means that these teeth have been rocked in their socket and the bones are growing in response to deal with that additional load, okay? Notice that here, the lower anterior teeth are worn through, okay? So it makes sense. That statement makes sense. So this is Liao sign with the airway from the airway image from the CT scan superimposed. Liao sign means that when you look at a patient from a profile view, the upper lip is either retruded, it's either flat or curled straight. I'm sorry, it's either drop straight down or curl back. Now, the more retruded the maxilla is, the more this is going to close down because this is not going to change. Here's a study from Spain that shows that if you can see, if the patient opens their mouth for you to check their hygiene, and you can see the uvula, they're probably at low risk for sleep apnea. If the uvula is barely visible or not at all visible, then they're at high risk of sleep apnea. This is called Friedman's tongue position. So here's an example of a hypothyroid tongue. Hypothyroid tongue is swollen. So this is like a supersized tiger inside that 3-foot cage, okay? Hypothyroid patients, they tend to gain weight, they're tired, their hair falls out, they have low energy, and they're susceptible to infections. So, and if you don't recognize this, you're gonna have a hard time getting them well with oral appliances. If the tongue is big, the jaw is small, you're gonna have tooth prints on the side of the tongue. That's called crenation. And crenation is being proven to be a risk factor for sleep apnea. Your sleep efficiency will go down from 85 to 71%. Translated, that means you lose an hour out of 8 hours sleep. And this tooth print, according to this study, is 70% specific for OSA. So people who's got compromised airway, their head posture is gonna be stretched forward so that they can open up their airway as much as you can. So when you look at a patient's head posture with them standing up, or at least sitting up, you can tell what their whether or not they have airway compromise. Okay, this is if you lay these patients back down, you lay them down in the back, they are ready for CPR perfectly. So what they're doing is they're trying to rescue themselves with this head posture. Another look at Liao sign, and an actual patient whose tongue is that big and whose airway is that closed. And if you don't rescue them, the only choice is CPAP or heart attack or COVID death. You really don't want that to happen to your dental patients, do you? And by the way, this patient has a crossbite here. You can see that this is so much wider because the tongue sits over these lower teeth, okay? So ED is the only healthcare topic that would get men to change their behavior. We're almost, okay? And what we know is that OSA induces erectile dysfunction and low testosterone syndrome. So if you are older in age, you have 40 times the risk for ED. If you have diabetes, you have 31 times the risk. If you snore, you have 2.2 times the risk. So if you snore, you're diabetic, and you're older, guess what? You have no chance, okay? So the answer is you test and you treat snoring early. It is not just a bedroom inconvenience or nuisance. Teeth grinding, another item in our wheelhouse, okay? Blood pressure surges 20 to 25% with sleep bruxism events. This is one study here. The other study here shows sympathetic cardiac activity was higher in bruxism patients. So these patients are going to be more stressed, more anxious. So let me ask you, how many patients a week do you see? And how many of them show matching wear facets? If not on your teeth, on their teeth, then it's on your night guard. What I say is that a typical night guard is a missed opportunity to assess impaired mouth and impaired airway and impaired sleep. So help them, okay? What I know now, just to give you 10 years of doing this, one-line conclusion, is that teeth grinding is just one frame in a movie. The movie is not malocclusion. The movie is called Airway Obstruction during sleep, okay? Because it's airway obstruction during sleep, you cannot do it from a dentist mindset. You can adjust the occlusion or realign the teeth until the cows come home. You're still aligning those teeth in the same jaw bone volume. Nothing changed in the 3-foot cage except you rearrange the teeth. So this young lady came in and said, I wore through my night guard. Can you make me another one? And I said, what is the definition of insanity? So I talked to her about what this epigenetic oral orthopedic appliance can do. And she said, yeah, that makes sense. Let's do it. So when she came, she looked like this. And 6 years later, when she came back for recall, she looked like that. Can a night guard do that? No. How did she get like that? It's because to treat the root cause of this, by the way, her mouth when we started, okay? We treated the root cause. She came in 3 years after her braces came off at age 17. And this is her anterior open bite, okay? So why is this anterior open bite there? Okay, why is this tree bent like this? You had to treat the root cause. Where's the force coming from? So we developed her maxilla. We gave her this appliance to sleep with. This rubber band hooks to this appliance here so that it gives her maxilla a forward stimulus. And in 10 months' time, you can see how her posture has changed. And you can see how her anterior open bite closed all by itself without braces, right? Because we grew bone volume for her using that epigenetic oral appliance. And so she's 17. Are you going to put her on CPAP? Or are you going to give her another night guard? What we did was that we tripled her airway. That's why she ended up looking so good. We brought out a better version of her genetically endowed potential. So ask yourself how many of these symptoms you have. That's what I often tell my patients when I was getting to close a case. And they will look at that and say, I got this, I got that, I got this, I got that. I just closed the case 2 days ago, and the patient, I got 6 of those 8. When can we start? Pain. Pain is a bigger issue than sleep and airway. You can compensate bad night's sleep with coffee and dark chocolate, but pain is annoying, okay? So the most universal complaint is neck and shoulder pain, trapezius pain. By the way, we dentists are licensed to treat the trapezius muscle because this is the foundation of the head and the jaws, okay? So the trapezius muscle trigger points will refer from here up this way toward the temporalis region, toward the masseter region, and toward the retromastoid region, okay? We are able to get rid of oral contributions to these pains predictably 95% of the time. So let me show you an example. This is one of our own. She's been practiced for 25 years as a general dentist. And she came in with Liao sign. She trained with me on my Airway Mouth Doctor training. And this is her airway. That's her Liao sign. So I know her maxilla is retruded, and therefore her airway is likely to be in trouble. And sure enough, she had sleep apnea with an AHI of 47, okay? And in 12 months, without appliance, it was down to 11. And even more interesting is this. She lost 110 pounds altogether after she got her sleep apnea under control. Even more impressive to me was like, wow, look at her right hand. This is her hand that she uses to do dentistry to earn her living. The highest she could raise was this much because of a rotator cuff injury coming out of the birth canal. She was yanked out and injured. It got an injury and it never would respond to any physical therapy, chiropractic adjustments, even rotator cuff surgery. Well, guess what? 3 months after this DNA appliance we gave her, she was able to raise her arm this high. All right. So there's an oral contribution to a lot more problems that we could ever imagine. And what we do is we look at this chronic aches and pains, we look at sleep bruxism. By the way, I want to pass on a message. We don't have enough time to cover this point, but A, B, C before D means airway, alignment, breathing, and circulation comes before dentistry. That includes implants. Never be in such a hurry to do implants. Okay, make sure you check out the patient's airway first. So this study shows that at the, this is pediatric obstructive sleep apnea, okay? So the conclusion from this study was pediatric obstructive sleep apnea in non-obese children is a disorder of oral facial growth. So who is responsible for OSA prevention? You get my point now, right? We should be trained so that we can help our patients to be proactive on sleep apnea. So cover this already. I just want to use this to close that teeth grinding is everywhere. In my practice, it's about 95% of the patients have bruxism issues. The lowest I've heard in my survey is 50%, okay? So for a problem that is prevalent, we don't have a good answer besides night guard. Well, here's your answer. Assess your patients for their airway. And don't see teeth grinding as just a dental problem. It's a systemic problem, okay? So if you're interested, we teach a course on AMD 101 with no prior training, and you can start seeing airway clues in your dental patient. And it's free. All you need to do is reach out to me at this email, and I'll be happy to send you the next course information. All right, so with that, I want to say thank you for attending this, and I hope you are interested enough to take up this wonderful journey in your professional development that you might even be able to start a new career. Thank you. Bye for now.
Hey, Felix.
Yes.
I get phone calls. Of course, this is Dawn speaking for those of you that don't know. As the executive director of the IABDM, I get phone calls for people who are looking for a whole mouth doctor. And I would love for us to have a way to add some kind of a certification button to the members.
Absolutely. Just start with AMD 101. Yeah.
But where do they go now? Where do I refer people to so that they can find someone who does a DNA appliance or Vivos?
I do. You
I
don't want
know,
to go.
I can't send you everybody. I'm talking about people that are in different states.
I know. I have a listing of those people.
Oh, I got you. Okay. Okay.
Yeah.
So I should just refer anybody looking for a whole mouth doctor to you.
Right. So what you need to know is this. Vivos has an entry fee of about $50,000 or $60,000. All right. That is supposed to be the training that they give you so that you can start doing this. But what I would say is that if you want to get in on whole health approach, we offer a different track that is not mutually exclusive, but more mutually complementary. And it's much lower, much lower cost.
So what you're speaking of, for those of you that don't know, Felix actually teaches a multi-module course. And so I'm going to give you permission here to advertise that, because a lot of people are going to call me and I'm not going to have the answers. So it's a year-long program.
No, no, it's a series. Well, it used to be that it would take about 3 months to complete this. You would, travel to Metro DC and we meet once a month, 2 days, 2-day weekends. And in 3 seminars later, you're able to start diagnosing these cases, and with a little help in the 4th seminar, if you want to take up this work to write prescriptions for sleep appliances and pain appliances, because the principle of diagnosing malocclusion is all the same. So now we're in the process of converting that onto online courses so that people just need to learn the hands-on part later on when the travel ban is lifted and people are not so worried about pandemic.
And
So
what
you can this is a good, the pandemic, during pandemic, a good time to join us for this opportunity.
could you put in the chat box down on the bottom, could you type in a contact information about how
Sure.
people would get in touch with you to be able to do that course? Number one. And
Sure.
number two, what materials are needed? I know that you have to have but the chart that goes on a wall, and I know you're going to need some special, like a sleep apnea testing unit that they can take home. Can you give them an idea of what cost would be to get into this type of dentistry?
Yeah, okay. So let me show you this, the last slide of my thing. Let me see here, do I have too many cases open here? Let me see, make sure I share with you the right screen here. Okay. Which screen are you seeing now?
The one that says US surpasses China for highest number of confirmed COVID cases.
Okay, let me start again, sorry. All right, let me give you the contact information here.
And Felix, while you're typing that, I know you can do 2 things at once because I know you. What is an average case so that these dentists
Good
can get
question.
an idea of what potential income could be?
Sure. Let me just get you my contact information first. I kept pulling out the wrong thing here. All right, let me see. Here we go. Keep going. Okay, I'm with you now. So can you see the screen about my contact information?
Yes. It
Okay.
just, well, no, what I see, no, I'm sorry, I don't.
No, we can't see it.
Okay, let me see. Where did it go? Was I even able to share that? This is really weird.
All you have to do is just type it in the chat box.
Yeah, but it's not letting me type in. That's what the weird thing is. Okay, let me go to more. The menu bar on that on my side doesn't work. I'll stop the share first. Okay. Chat. Here we go. All right, so let me just verbally give it to you. I don't understand why it's so complicated.
Okay.
So it's DR Doctor, DR like doctor, and then my name, Felix Liao, one word, @gmail. So DR Felix Liao @gmail.com. And my cell phone number is 703-424-5666. 0322.
Okay, Felix, the question that I had before, I'm not looking for an actual cost. I'm looking for a range. If you're looking at trying to create an alternative income source,
Right.
and you're not doing mercury removal because maybe you're trying to get pregnant or whatever, and you just don't want to be in that kind of environment
Yeah.
would you say that an average cost is anywhere from $2,000 to $10,000?
No, I would say you can easily charge anywhere from $4,000 to $8,000, and you can do the math, see how many cases you need. I would tell you that the sweet spot is somewhere between $4,000 and $5,000, but there are built-in issues with lab cost and educational cost. How to get into this, we have a separate seminar coming up, and I would just encourage you guys to reach out to me, and I'll give you the link to the next webinar on that. The sweet spot in the marketplace in this day and age, in the last 2 weeks, I had 3 patients who accepted treatment over teledentistry because they hurt and they want a solution now. And they said, can I pay you cash instead? I said, of course. And so it's a good way to augment your income, and you find a sweet spot and they want this. The patient wants a solution. Your patients are actually turning blue waiting for you to get this connection and provide this service. So the only major requirement you really need is a cone beam CT scanner that is 15 by 15 field of view minimum. If you don't have that, you're gonna have a hard time showing the images that I show you and make the diagnosis completely. So get the right equipment and make it irresistible for the patient to say yes. Did I answer your question?
Yes, you did. Of course, I realize everybody's going to be a completely different fee, and kids may actually be easier than adults. I'm going to encourage people to take the training on this because this, I know when Felix first talked to us about this, even us as an organization was kind of headstrong as far as, well, what does Airway have to do with biological dentistry? But Felix has been very persuasive and has more than convinced all of us that it's everything. It's everything. It's not alternative medicine to breathe.
No, this is first line care. That's why I started out with COVID. All the underlying conditions that results in COVID death is the result of poor oxygenation, over-oxidation, lack of antioxidants. And so it's not a question of diet. You can eat organic and you can eat perfectly until the cows come home. If you have a choked airway, you're still hypoxic. You're still inflammatory. You're still pro-oxidant rather than antioxidant. So this is a vital service that we're providing. It's, you know, like I'm fond of saying that I'm coming out with a new book called License to Thrive. It should be ready in about 3 months. And the manuscript is ready, so anyone who wants to read it, just reach out to me. I typed in my email and the chat box. I finally got the chat box to work. So,
yeah, you already promised it to me, so I'm expecting mine.
Yeah, okay. So, but if I don't get an email, I can't be held responsible. So if you want to just, you know, draw me that line, Okay.
Oh,
But
I'll do that.
yeah, the point is that every one of us were born. Every one of us were born. Okay. Helpless, except that we could suckle and we could sleep. And it is through repeated cycles of sleeping and eating that we were able to gain energy and grow. Okay. So the mouth is really foundational to our growth and development, and energy from oxygen and energy from food. All right. So what I see ventilators, I just want to repeat that point, is that the ventilators are heroic ICU rescues. They are the last line therapy. Okay. The first line therapy is what? In that row of dominoes that end up in ventilation. The first line of therapy is a healthy mouth development with a wide open airway and a healthy use of the mouth. We are the first line therapy to keep that first piece of the domino standing strong so that you don't collapse into that final piece that drops off. Okay? I got your email.
Yeah.
Yep.
I'm always
All
going to
right.
be first for everything. Felix, I
All
want to
right.
thank you.
Very
Before
well.
we leave this evening, I want to give a shout out to Dr. Lavu because she just became certified today as a biological dentist. So those of you at home can give her a little hand, and I'm going to encourage you
Congratulations.
all to sign up and get certified.
All right. Well done, Don.
Thank you, Felix. Well, this will be
Teresa Scott, thank you for your leadership. I think it's great between the two of you.
Thanks, Felix.
All right.
We love you.
This will be,
Okay.
the recording will be up by tomorrow. So you guys that have friends that need to listen to this or you want to listen to it again, look at the slides. It'll be up soon. Thanks again. Tomorrow night, we will have another Zoom speaker, same bat time. You've got hygienists. We've got a program set up for them an hour earlier, and we have a different link for that. So look on the website, and I know Fran and Teresa are very good about posting that as well. So I see you guys tomorrow night.
Yeah, tomorrow we're talking to Kelly Dyer Hayes. She's from the Surgically Clean Air.
You guys won't want to miss it.
Nope, don't want to miss
Thank you. Okay, Nikki, you can cut the recording.
Okay, night, everyone.
Good night.
Bye.
Great job, Felix.